Right, so what we're going to do tonight is focus in on liver fluke and specifically some of the common misconceptions that we get from the field and just talk about those because they tend to be pretty interesting issues. And we've come up with 10. Maybe your questions will expand that, but we're going to start with 10 tonight. The first misconception to zoom in on is this idea that because we really just focus our treatment with registered products in cattle and sheep, that liver fluke is really just a cattle and sheep problem. But if we start having a look at the life cycle, you notice straight away, what's Skippy doing there? Why is there a kangaroo in the life cycle? Well, some really great research in Australia demonstrated that kangaroos were not only able to become infected with liver fluke, but they're also able to contribute to pasture contamination with eggs. And in fact, if we look at which hosts liver fluke can become fully mature in, it's actually all of things like sheep, cattle, horses, pigs, goats, alpacas. If we look at some feral animals in Australia, we've got deer, rabbits would certainly be able to get liver fluke. And if you look at wildlife, there's no reason that wombats have also been established to get liver fluke. So what's the relevance of this? The relevance of it is that, okay, we treat our cattle and sheep, but we need to know that unfortunately pasture contamination can be occurring from all those hosts as well. Now, for those who don't know, unfortunately, people can also get liver fluke. So if you have a look at the left-hand side of the life cycle there's little cysts waiting to be ingested by any sort of grazing animal. Now, while we don't put our heads down and eat grass in the paddock, if you were to, for example, grow watercress in an area that supported liver fluke, and then those little cysts went onto the watercress, you would actually get liver fluke. And in other countries of the world with this form of liver fluke and others, liver fluke can certainly occur in people, and it is a major issue. Now, while we've got the life cycle up here, it's important to recognize that we've got the adult parasite living inside the liver of the animals, and then this is a parasite that is successful by spitting out ginormous numbers of eggs. So, you know, especially in sheep, which don't develop an age-related immunity, really, we're talking 10 to 50,000 eggs per fluke coming out. Cattle can also produce very high numbers. They do develop a bit more of an age-related immunity, though. It's a parasite that those eggs then hatch, and it needs to be above 10 degrees for that. And then it needs to get into the intermediate host. So you don't have liver fluke on your farm unless you have a specific water snail. And then if conditions are good, there's stages that develop in that water snail for a couple of months. And then you get little tadpole things you can see there coming out, and they will swim in the water, they lose their tails, and then the cysts go onto the pasture. Now, since we're talking about the life cycle, I don't actually have a TikTok account, but I'm sure all my kids do. But I did hear through some people in the field that they were concerned that liver fluke was going to get into their cattle from ants. And it shows you why information on social media, we always have to fact check, don't we? Because this is not liver fluke in Australia. But it is interesting for anyone who saw this, the craziest animal life cycle, is that you can see the little official life cycle down the bottom there, that in countries that have a fluke called the lancet liver fluke, so that's different to our liver fluke, a different species, you do actually have a situation where you can see that it's going into the snail and then coming out into this ant, and then, you know, the cattle or the sheep would become infected by accidentally ingesting the infected ants. But in Australia, not relevant to us. The second misconception to cover is this idea that, okay, maybe if the snail's the problem, if I can control this snail, I'll be able to solve my problem. The challenge is that this is not an easy snail to find. So here's a bit of a joke picture. The idea is that it's not like this at all, but it's actually a very, very small thing in the paddock. And it's actually a very specific snail. It's not the snails that you see in the water troughs. It's a very small snail living in slow-moving watercourses. So it isn't actually possible to easily find this snail. But you can actually do some things, and it's important to consider things that we would call non-chemical management for liver fluke. So you can learn or get some assistance to identify this snail, and you can actually go out there and meticulously look for areas on the farm where you can find this very small water snail. Now that in itself is actually quite interesting. You could, with enough work, identify areas where the snail loves to thrive and areas where it doesn't need to thrive as much. Generally, if you're pretty confident an area is fluky on the farm, the really established non-chemical method would be, could we attempt to fence off some areas? Now, that might sound impractical, but there can be on some farms a high fluke risk, say, from leaking irrigation. That's hard to sort of fix the irrigation necessarily. You could fence off an area where there's very slow moving water that's very productive for the snail. Of course, draining areas where this snail lives could be effective. The thing is that the snail reproduces so readily that, like, say you were actually to control it on your farm, it will rapidly repopulate from adjoining areas. And of course, watercourses move, we have flood events, and so you'll rapidly get the snail coming back in. If we were actually to attempt to kill the snail using, say, molluscicides, which are used for domestic snail problems in the garden, it probably would work, but the effects on the ecosystem would be absolutely intense. Now, if you do know the areas on the farm that are fluky, it's worth saying that a non-chemical technique that is not done very often, but is theoretically quite effective, would be to do a pasture rotation where, imagine, say, today I have a mob of cattle or sheep, I give them today a very effective fluke product, and then I deliberately say, fine, I'm going to put them into the fluke area now. And because our knowledge of the fluke life cycle is it takes 8 to 10 weeks until the liver fluke grow up to be mature, as long as we take those animals out of that fluky area, say at around the 6-week mark, and put them into a non-fluke region on the farm, we will really have done a good thing. We can leave them in the non-fluke region of the farm for a pretty long time, and then we can repeat that concept of treating, putting back in. Before sort of embarking on something like that, get some advice to make sure that it's certainly sound for your property. Another interesting misconception is that we get a lot of advice, calls seeking advice. Why have I got fluke? It hasn't been raining. Or I might drop my fluke drench because it's been really dry. This is unfortunately a significant misconception, and really understanding the life cycle is where this goes on. Let's first of all look at why there can be increased liver fluke when it's wet. Okay, so when it's wet and especially warm, just imagine that the snail life cycle is powered up. Those little tadpole-looking creatures, they can swim more, the snail is happy, and you get more and more fluke on the farm. So you could say that a wet time is favoring the factory. So the factory, the endpoint of the factory is these little cysts that are sticking on the grass, and this is where it relates to now the dry time. So some animals, especially sheep, will not really voluntarily graze right into wet areas when the water's there. Cattle will be more willing to. Now, when it dries out, the cysts are still on the grass from when it was wet. So actually, sometimes we get liver fluke outbreaks or significant liver fluke productivity loss because animals have just had more opportunity to graze an area where there was significant burdens of fluke cysts on the grass. And that's a very common problem in sheep, but also can occur in cattle, that they just get more access to it. Now, of course, if it gets drier and drier, prolonged drought, very hot, very dry, you will end up losing those cysts on the grass and the risk would decrease. But certainly if you have had, say, a wet year and then it's drier, you're still going to have a liver fluke risk there in the drier season. Something else that's become more and more common to do manure testing in our cattle and sheep, and we can submit our samples for worm control reasons. Maybe we want to know, do I need to give a worm drench at the moment? And we look at the form and we just go, well, I'll just tick fluke. That could be interesting. And if the idea is that we get a negative result back on our report, is it true that we can say to ourselves, well, I mustn't have liver fluke? Well, unfortunately, the test is not very sensitive. So just because we get back a negative report for liver fluke eggs does not prove that those animals don't have liver fluke or that our farm doesn't support liver fluke. On the other side, which is a really important point, if you find just one liver fluke egg in the test, it's important because it means that you have liver fluke on the farm. So really where it's confusing is a negative result is a little bit confusing, and that cannot give you the confidence that you don't have liver fluke. Like, to think about why it's challenging for a laboratory. So, I mean, here's looking down a microscope and yeah, there's eggs there somewhere. And then, you know, we zoom in and we can find these liver fluke eggs. But the thing is, these liver fluke eggs are not even shed consistently every day in the animal. It's a parasite that lives in the liver. The fluke produce eggs and they travel down in a substance called bile that is stored in the gallbladder, and the gallbladder is sporadically released, and then the eggs get into the intestine and they'll work their way out the back end. So when we happen to take our manure samples, we may fluke, that's sort of meant to be a joke, getting some fluke eggs, or, you know, there's just as much chance that maybe we didn't see them. Now, of course, it depends how much fluke is in the animal. If it's a very sick animal, there might be more chance. But I think a really good thing to think about when we're asking for diagnostics on manure for liver fluke versus worms is they're not the same at all. I mean, you know, worms are living in the intestine, the eggs are directly getting laid into the intestine and passing through. As I mentioned, the fluke is in the gallbladder. The other thing is that there's different immune responses to these parasites. So if we just focus on sheep in the beginning, you know, they don't produce as strong an immune response to liver fluke, so you have more chance of seeing fluke eggs in sheep. But then if we cross over into cattle, they can still have liver fluke, but their immune system can be really decreasing the chance that you will find the eggs coming through. So yeah, it's really not an easy process. And the same sort of is in worms between sheep and cattle as well. For interest, that worm egg counts in sheep are quite reliable to predict how much of a worm burden is in the sheep, but in cattle, worm egg burdens are not quite as reliable to do that. And then in fluke, neither in sheep or cattle is the egg count for flukes really telling you how many fluke are in the animal, but it's slightly better in sheep. So that hopefully clarifies the challenges of testing for liver fluke by manure. And really that therefore should make us say, well, what can we do better? And when we're thinking about doing some testing for liver fluke in herds, we really need to ask ourselves, well, what's the point of the testing? What are we doing it for? And one reason for doing the testing is to say, does this group of cattle or does this farm itself have liver fluke? And if that's what we want to know, the most powerful test is to get someone to take some blood samples from some cattle, or if it's a dairy farm, from the milk vat. The animals that you're testing, say you're taking blood samples, need to be homebred animals. They need to have grazed the pasture for, say, you know, at least a season, perhaps a year. And so sometimes replacement heifers are quite a useful group, and you can sometimes compare them to cows. You only need one milk vat sample, but if you're taking blood, say, from beef cattle, you're probably best to get 2 pools of 5 is what often I submit for. And what that testing does is it goes off to a laboratory and it's called an ELISA test, and they measure antibodies. And antibodies are evidence of exposure. So the test result is saying to you, this is how many antibodies are in the animals, and this indicates that they were or were not exposed to fluke over the last while. And the antibodies last for a long time, so that's why it's a useful test to say, does this farm support liver fluke? Now, abattoir kill sheets is a really useful way to suspect whether you have liver fluke or not. You can also ask your abattoir if you're not getting a kill sheet. The only thing with that one is it's often quite sensitive, but the word, how specific is it all the time? Because sometimes livers might be condemned for things that look like liver fluke and it's coded as liver fluke. And there have been some investigations where an abattoir kill sheet has shown, yep, there's liver fluke, but then you go on farm, significant testing, and you fail to find that they've been exposed. So, you know, it is a very useful thing, abattoir data, sometimes can need a little check. Now, as I said, an egg count could be useful if you find one, because the presence of just one egg can demonstrate that you have fluke, but then a negative result isn't useful. There is another test in Australia, the coproantigen ELISA, and it can also be used to see is there fluke in these animals at the moment. But once again, it's looking for actual presence of fluke, which can be hit and miss depending which ones you test, etc. So that's why the preference for does your herd or farm have liver fluke would be the ELISA type test. Another reason is we might be looking at our animals and going, gee, they're not growing as well as they could have, they're ill thrifty, or we may actually be a vet investigating disease in a group of animals, and we're wondering, could liver fluke be involved? Now, in this situation, what I do is I definitely rely a lot more on a fluke egg count, because actually the antibody one, the ELISA, will tell me, yes, they've been exposed to fluke, but it's not going to really help me, but is that the problem right now? So I can run my serum or milk ELISA to tell me that fluke is at least on the farm, but it won't help me know if this animal right now. So luckily, when animals are actually obviously sick or obviously huge weight loss from liver fluke, you should, if you test enough, come up with some positives for liver fluke to help you there. And you can use the coproantigen ELISA for that as well. And it is going to be a bit more sensitive, I think, for that process. Now, as a veterinarian, you might say, well, can I collect any other evidence? So you might run some biochemistry or something to check our liver enzymes up as well, some other evidence for why it's liver fluke, and also looking at the specific clinical signs in severe cases. Do they have, you know, swelling under their jaw, anemic, diarrhea, etc. Trying to put together a diagnosis. Now, the last one, which is not the least important though, is finding out whether your last fluke drench worked. And so just like in worms, unfortunately, fluke have become resistant to some of our chemical classes, and you can test this, and ideally you would take some manure on the day of you giving a fluke drench, and then you come back 21 to 28 days later and take another sample. Why is that longer? Some of you might be thinking that for worms we test 10 to 14 days. It's because it takes a lot longer for those fluke eggs to come through. So if you were to test too early, it could be unreliable. So we wait longer to make sure that you haven't got eggs from previous fluke. So you can do manure testing for that, or the coproantigen ELISA. And if you're interested to do that, certainly seek some advice from an advisor, and is a good idea in particular to test triclobendazole containing products, which we'll cover soon. A bit related to what we were talking about with the testing is that idea that, well, liver fluke is not really a problem on my farm unless they're looking fluky. You know, a visible symptom of fluke, like I said, might be that beneath the jaw you notice a bit of a swelling, often called bottle jaw, or you might think that they just look like they're not moving forward as well, losing condition, a paleness to the animal if you looked closely. So it's a bit of a misconception that that's the main problem with fluke, and that's when we should use products. And the best way to explain that is this is a parasite that is infecting, you know, all the animals in the paddock, and the word subclinical refers to things that we don't see as sickness but are going on in the animal. And really, with just quite a low to moderate fluke infestation in an animal, you won't think it looks any different, but that animal has grown less. Now, while as a veterinarian I can notice a 50 kilogram difference in animals and vary my penicillin dose, etc., it's pretty hard to notice something like 10 to 20 kilos in young cattle. And that could be happening. You might have fluke on your farm, you might think it's not a problem, don't need a treatment, but you are actually losing 10 to 20 kilograms compared to if you roll out a strategic fluke program. Also, there's good scientific research showing that fluke burdens will affect fertility, and that can be considered sort of subclinical, that you're not really noticing as a major problem, but there's a reduction. And as it says there, milk and wool production. So the most significant problem with Fluke is actually subclinical, and that's not noticeable, but it is leading to poorer production than you could get. Some of the clinical syndromes of liver fluke, hopefully I do not see very often. I have over the last 25 years seen some fluke outbreaks. For example, if you have some young cattle that haven't developed any immunity yet, and they're put onto a paddock with huge numbers of fluke cysts in that grass, they can die from acute liver fluke. Then there's also subacute stages where they die within 8 weeks. Or you can just get very, very sick animals. Hopefully these days we can design our preventative programs so it's very rare for us to see an outbreak of liver fluke or obvious clinically ill animals. Related to that, once again, is this idea of, well, when can animals first get fluke? And there is an idea that maybe they don't need a fluke drench till they're 8 to 10 months of age. And you know, this comes down to thinking about, well, do we see fluke disease before that? And yes, I have. There's no doubt that calves can start collecting, for example, liver fluke burdens at 4 to 5 months of age that are then going to make them sick or not grow as well. And you may or may not know that, in fact, a calf, it doesn't happen all the time, but rarely it has been reported that a calf is born with liver fluke. So how could that happen? Well, the parasite is amazing. When it's swallowed into the animal, it goes into the intestine, and then it says, well, where's the liver? Where's the liver? And it penetrates through the gut wall to find the liver. So it just so happens that sometimes that parasite has kept going and has found the calf's liver. And that's been documented because post-mortems on a calf, which is well within the life stage of getting from grass, already had fluke. So really, what do I say as an advisor for this issue? And it relates to my advice for worm control as well. If you're weaning animals, say calves, and it's after 6 months of age, it's a bit late. So say in this example here, if they were weaners at 8 to 10 months of age, they've been on mum for that long and they haven't had a drench yet, well, that's too late. So they should have had a drench while on mum. Whereas instead, if you're weaning at about 6 months of age, we generally consider that satisfactory for that to be their first drench. So that it doesn't, you know, it's not my role to say whether you should or should not wean at 6 months or older. That's everyone's own enterprises, and there's lots of decisions that come into that. But when it comes to parasite control, that's the advice I give. If you're weaning at 6 months, that can be the first drench. If you're weaning after 6 months, you need to consider a drench while on the mum. Now, liver fluke being only a problem in autumn, and look, if you look at the data in Australia, and I think also with our survey tonight, is that it's well accepted that autumn is a really, really important time to control liver fluke, but it might have got a little bit confused that we're over-reliant on that and thinking that that's great, job's done, you know, I waited, there was a frost, and then I gave my treatment and it's all good. Realistically, it's good to go back to some of the science of this and understand why on earth we ever thought particular times that we need to give treatments. And if you look at this calendar here, it's showing the months of the year, and the graph is about, you know, how many fluke numbers are out there in the paddock for the animal. And interestingly, the blue line, which is obviously got a very, very big peak in autumn, is if we only give an autumn treatment. So if we only treat for liver fluke in autumn, we will have a massive impact on the parasite. And the reason why that's an important time is because the snail doesn't like the colder weather coming, we get less activity, so we clean the fluke out of the animal, and at the same time, the intermediate host is not active, and so we've done a very strategic treatment. But following just that blue line at the moment, you can see that the numbers will rise again, and they certainly will rise because of a number of factors. It might be that you actually did not fully remove all the fluke from the animal, or that you're just simply getting fluke numbers establishing back in enough numbers in the paddock and then into your animals. Now, with the red line, you are seeing what happens if in a research trial here, you did an autumn and a spring treatment, and not much different to when we talk about strategic cattle tick programs or other parasites. It has a massive impact on that cycle overall to roll out the autumn and spring. Now, so if you're thinking about, well, how many fluke treatments do I need a year? That is actually probably to work with an advisor. But in general, in my viewpoint, if you're in a farm with known fluke activity, basically all ages of cattle on the farm are more than likely going to need an autumn and a spring treatment from what I see out in the field. Now, young cattle, and this is, younger animals, probably true in sheep as well, are potentially going to need a February summer type treatment as well on some people's farms. But the thing is, if you do a strategic fluke program really well over time, the aim is that you're decreasing fluke numbers more and more, hopefully, in your farm, and you can get advice and do testing to try and potentially reduce it. So, for example, some of your farms may right now benefit in young cattle from 3 fluke treatments a year. You would get a massive productivity gain. You do that for a while, you might be able to drop it back to 2, etc. So there's not one size fit all, but it is important to recognize that while autumn is important, don't forget that spring can be important. Now, sometimes why spring is a really important one is the timing of the autumn one has, unfortunately, you can only do the best you can. Maybe you wanted to treat weaners, maybe your autumn treatment, it was still a bit warm, and so you have ended up with too much survival of fluke, and you end up definitely needing a spring treatment. Another idea is how does liver fluke spread, to think about that. So this idea is, well, I don't ever need to think about liver fluke because it's not in my area. And so this misconception might come from looking at a map, maybe in a government fact sheet or some other source, and saying, well, hang on, I don't live where the map is saying there's liver fluke, so I'm fine. I don't ever need to consider liver fluke. Okay, well, there's 2 things to consider with this one from my experiences. One is the maps are just a guide. The liver fluke snail might happen to be in areas well outside those high intensity fluke areas because you happen to have a local pocket of an ecosystem where the snail has thrived and has been brought in. So that certainly is documented. But a much more important issue is, and here actually this is a useful map taken from the abattoir data to just see the local variation you get in fluke numbers, which is basically environmentally driven. So the areas which are red or orange have an area that suits liver fluke more than others. But I guess the idea is, yeah, this is just a map based on some numbers that have been collected. Your farm is an individual place and you might be living in one of the areas there where it's yellow, but you happen to have a fluke level that is like a red area. So it can happen, or vice versa. You might be in one of these red areas, but your particular farm doesn't support the fluke snail, for example. Now, the really critical issue that we're finding is that cattle, of course, move all the time. So this crazy sort of graph here is showing the number of cattle moving according to the National Livestock Identification System. So lots of cattle are moving every year. And if we look and focus just sort of on the yellow section of this, that's how many cattle are moving from one farm to another farm. So lots and lots of cattle are moving, of course, all the time, and they are moving from areas that have had fluke to not fluke. Now, what happens is it means that if cattle are brought from a farm that has fluke to a farm that doesn't have fluke, if you don't provide a fluke drench when those cattle are brought on, the fluke will just live in those cattle or sheep for years and years and years and years because they can live. So they will be a source of production loss for those animals that might not be identified. Now, that is what will happen on a farm if there's no fluke snail. Eventually, those animals die or the fluke dies, and if there's no fluke snail on the farm, it doesn't set up on that farm. But of course, if it is a farm that has fluke snails and you bring in cattle from someone else's property, not only will those cattle have the fluke in them, but they will add to your own fluke problem. And the really important point is what chemicals those fluke were exposed to. So you could be bringing in more resistant liver fluke than your own. So that leads to the concept of quarantine drenching, which we'll talk about a little bit later. And just as another way of looking at that data set, I think it's interesting to see that, so on the left, you've got the states, and at the top, you've got the states, and then where they meet, New South Wales and New South Wales as the matrix, is the number of cattle moving within the same area. So what it's saying is that 77% of cattle movements in New South Wales are to New South Wales properties. But you still do get movement there. You can see to other states, and the state that you live in, you can look at that and you can see where your cattle are moving. But I mean, we know that there's a lot more liver fluke in New South Wales along the tablelands and East Coast, and then in a lot of parts of Victoria. So those areas are spreading fluke amongst themselves and a little bit outside that region. Another misconception that we pick up is about the terminology about the stages of fluke. I think most people recognise that there are some products you can buy that only control adult fluke, and sometimes we do that, but it would be better to treat immature fluke. But what's not as well recognised is that actually there's 3 categories of liver fluke that we divide them to by definition. We have early immature fluke, which are very young, they're sort of like 2 weeks old, hitting that liver, doing some early damage in the liver. And then we have what are called immature and then adult, so 3 categories. And some very early work, and a lot of the best agricultural research was done many decades ago when there was a lot of funding for that and issues. And Dr. Bore, who is our leader in liver fluke, was so well recognised in his career for liver fluke, did this study here. And what it's looking at is what different productivity do you get if you only control adult fluke versus if you control the immature fluke versus the early immature. And so looking at this study over 20 weeks, you can see that on the far right, we got growth somewhere of around sort of, I don't know, 14 kilos or something if we only control adult fluke. So that would be like with a plus product or Nilzan or something like that, if that's all we use. Then if we use a product that can manage to clean up some of the younger fluke, which are damaging the liver when they're hitting the liver and migrating, we got an additional 5 kilograms gain over the growth of those animals. But then if we were able to use a product that was able to control down to the early immature stage, we then got another further additional 8 kilograms. And it makes a lot of sense because we do know that a lot of the damage is occurring in the early stage when the fluke is actually migrating its way all through the liver. So the better we are able to take out those early immature flukes, the better. Now, triclobendazole, looking at our misconception 10 here, has been the mainstay of controlling liver fluke, and many products on the rural store shelf contain triclobendazole. You know, on the label it says it does liver fluke, but we have these discussions these days with lots of awareness around chemical resistance for worms, that the labels of products that we buy reflect when they were registered, perhaps decades ago. There's no legislative change. The labels don't need to change. That would be complicated. The labels reflect that it would kill parasites that are susceptible to that chemical. And when the chemicals were first brought out, that would be true. But triclobendazole has been around for many, many decades. And so just because the label of the product says it does liver fluke, doesn't mean that it still is now. And so there has been some formal studies in this, just to look at one of them in 2014, which is now a long time ago, but as early as that time, going to properties where someone was saying, you know, I'm not sure about my liver fluke drench. Half of those properties definitely had confirmed resistance in their liver fluke, and so that triclobendazole as a common chemical was no longer working. So triclobendazole is in some oral products, some pouring products, and it certainly is globally recognized as a problem that we have triclobendazole resistance. Now, in recognition of that, and also, I guess, in recognition that liver fluke is an important parasite, I would like to acknowledge and thank Meat and Livestock Australia researchers who have this current active study, which is in progress up to September 2025. But luckily they have shared some of their interim data and what they've found in terms of that chemical resistance idea. And this is, I should explain, very much averaging data to come up with these graphs. So imagine 4 properties with the testing done, and triclobendazole was only working at 51%. So I think from memory, something like 3 out of the 4 properties, effectively, triclobendazole is really not working well, and 1 a little bit better. If we compare that to a more modern formulated Fluke product, just as a comparison, we're getting 99% Fluke control with a product containing nitroxinol nitrofluke in those studies. So no doubt we will hear a lot more about this project. Perhaps some of you listening are even involved in this university study, and we can see what else we learn about current resistance status. So what is this one with nitro containing in it? It contains, there's nitrofluke, which is only for liver fluke registered, and then there's nitrometh, which has claims for both liver fluke and worms. Both of these products contain nitroxinol and chlorcelon, and they have been developed in Australia specifically to deal with the problem of triclobendazole resistance. And it's a very good example that often we think in human health or animal health, oh, there's this big problem, things aren't working. What we need is to totally invent a new molecule. But some of the most amazing ways to treat human cancers or to solve problems in livestock have actually come from reformulating, rethinking, repurposing old molecules. And so this is an example of nitroxinol. In fact, it was a long time ago sold in a product called Trodax. In this product, it's been totally reformulated with chlorcelon, and this product has a totally different mechanism of action against triclobendazole. So producers who have cattle, because this product is only for cattle, beef cattle in particular, is able to use this product as an alternative to triclobendazole, and really all beef farms should use this somewhere in their production cycle to be able to give triclobendazole a break. Unfortunately, we cannot use this in dairy cattle, and we can't use it in sheep. Now, the thing about the nitro products is amazing product, will sort out fluke that's not being killed by anything else. They do have long ESIs, which is a feature of the nitroxinol molecule. So we get fairly long residues in the order of 120 to 140 days. So a common question to me is, well, what do? I have young animals. I know nitro is really good, but I need a lower ESI. Well, out of the products that contain triclobendazole, this one is performing better than ones that only contain triclobendazole. So we call this a synergy. So flucazole contains triclobendazole and oxbendazole. Now notice that they have a similar ending to their words, but in actual fact, oxbendazole is primarily understood as a molecule against worms, and triclobendazole is only against fluke. But interestingly, inside the animal, something a little bit magic happens, luckily, is that there's a very similar liver enzyme to break down these chemicals. So when you give a dose of flucazole to your cattle or sheep, the chemical will be broken down in the liver and then eliminated. When the body gets exposed to both of these, it's safe. It significantly slows down the ability to remove the triclobendazole, which leads to much higher levels in the liver tissue. Joe Bore, for the registration purpose of this product, was able to demonstrate that's a true synergy. Synergy means that you get a better control of liver fluke than if you were to give the things separately. So while it contains triclobendazole, and we need cautious on that, if you do need to use a lower ESI and you are using nitro somewhere else in your program, it can be a good idea to use flucazole, say, in young animals that are going to end up as slaughter animals, and you make sure that some animals that are retained on your farm and are therefore going to spit out eggs are definitely given some nitro where you can absorb the longer ESI. If we have a look at, because in the end, talking about resistance and what working is not working is one thing, but what people really like to see is, yeah, but does that make any difference to the animals? So here's a study that I was involved in some years ago, and it looked at comparing in about 150 weaner cattle in New South Wales. What happens if we give Genesis Ultra? I'm not sure if that product's available anymore, but there are other ones very similar to that, and it's a triclobendazole containing poron with a worming ingredient as well. That was given to a third of the weaners, and then another third were given Nitramec, which we've talked about, contains nitroxanol, and then another third were given flucozole and the moxidectin and sodectin. So every group was given a form of fluke and worm control at the same time. And then what this table is showing, at different days after treatment, when did we start to see fluke eggs coming back? And remember that compared to worm trials, you don't necessarily see a lot of fluke eggs. You know, you get what you get in a field trial. And we can see that the single active triclobendazole in the first row, we were seeing the fluke eggs coming back at day 71 and 139. With our Nitramec product, we never saw the fluke eggs during this entire study. And in our product with the flucozole, which is the triclobendazole and the oxbendazole, we saw some fluke eggs at the day 139. Then you could say, well, what does that mean? Well, if you look at the production response, we ended up with the Nitramec with 55 kilograms growth over this trial, flucozole 54, and Genesis 43. Now, admittedly, you know, this is a guide. These are trials done on commercial farms to understand useful information for that producer. In this case, it gave him valuable information. Of course, there also is worm control differences occurring here, and that's hard to tease out. But the general idea is that some Fluke products will work better than others, and some Fluke programs are going to deliver more productivity for you. So let's summarize quickly what we've learned tonight. First of all, we had maybe a surprise for some people that Skippy can also get liver fluke, and lots of things can get liver fluke. We learned about that while we can't hope to kill the snail, we can definitely implement some non-chemical methods and think about where the snail is, and even consider some rotational grazing strategy if we have the resources and the time. We've learnt that just because it hasn't rained yet doesn't mean we won't have liver fluke, and in fact, especially in sheep, we could have significantly increased risk because those sheep are grazing more in areas where it was once wet. We've learnt some of the limitations of the diagnostic testing for fluke. It's not to discourage anyone from doing that. It's just very important to know that a negative fluke egg count doesn't mean you don't have fluke, but if you find one, you definitely do. And we also talked about some of the different ways of rolling out testing depending on what you want to know, and that the blood testing or the milk ELISA for dairy guys is the best way to find out if your farm does or does not have fluke. We also learned that if we were only treating animals for liver fluke when we say, oh, look, they look fluky or there's a problem, we are likely losing a significant amount of hidden production, because by the time they've got to the stage of having those clinical signs, they've already lost weight, already lost fertility, they've already had problems that we couldn't see easily. We had a little chat about in programs that if calves are staying and mum's doing all the work for longer, we might actually be losing productivity because actually the calf is eating grass as well as milk and it's getting fluke. We also talked about that often a spring treatment is forgotten, or it's often made too complicated. Things like, oh, well, I'll use an all-stage product in autumn and I'll use an adult only in spring. But increasingly, those programs can be a little bit flawed because it's very hard to have your autumn drench at a perfect timing to say that you only need an adult one in spring, or depending on the fluke burden on your farm, it's highly unlikely you can get away with just one fluke treatment for the whole year, because you've allowed your animals to collect a lot of fluke waiting for that one a year. And I mentioned that in my experience, you see a difference there between this stage of animal, that while all ages might benefit from autumn and spring, the young may actually need a third one in February. We talked about the problem of moving animals and that fluke can be spread, and that even if your farm doesn't support liver fluke, you'll need a quarantine drench. We also raised awareness on that products can have quite differences as to whether or not they kill early immature, or adults. And finally, we discussed the really important issue that's emerging on that there is definitely chemical resistance to triclobendazole, and is probably a lot more widespread than we know, because it is quite hard to do liver fluke resistance testing. Now, I think we're going okay for time. I'm just going to give a little bit of guidance as to how we pick Fluke drenches. And here is an imaginary store selling some Fluke products. And one thing that I like to give help to people is, well, what are the sort of important things that we would consider? And, you know, we obviously need to know which stage of Fluke are they going to control. So let's have a look at that quickly. So the products in the middle row on the left, Verbamec Plus, Ivomec Plus, and the yellow one down the bottom, Nilzan, those type of products only control adult Fluke. So that's really important to know. They're only doing adults, and sometimes that can be acceptable. You know, if you've really got a program sorted and more in spring, maybe these products sometimes have a role, but often they are a little bit flawed in only doing adults. Now, the products like Fluke Care, Cydectin Plus Fluke, Fasomec, Fasonex, Ivomec, actually everything else on the bottom row and half of the middle row, they per label can do immature Fluke. If there is triclobendazole resistance on your farm, they may be struggling to do that, but per label they can. Up the top, the Nitro range will definitely do all stages of Fluke. It's been recently tested and is going to be highly effective against that. Flucosol C contains triclobendazole also, so needs some caution, but it does have a labeled claim, and on many farms will be having a significant improvement compared to the straight triclobendazole products to pick up early immature. Another thing that we need to think about is what ones do we have resistance to? So really, everything here pictured except Nitro probably has resistance to it. So everything except Nitro Fluke and Nitromec, but it's very hard to find that and design tests for some of it. So we know that all of the ones like Fluke Care, Cydectin Plus Fluke, Fasomec, Fasonex, Ivomec Plus, all those ones in this picture, we've documented resistance. We know that in the plus products, sometimes there's not as ideal control as we would have liked, but it's quite hard to measure. Nilzan, not much resistance. It only does adult Fluke, but it's certainly not been documented to my knowledge much. Now, the other one is ESIs have to be considered. So products here that have short ESIs include, as I mentioned, the Flucosol, the plus products, the Fluke Care. And be very, very careful with the pour on Fluke products, because people sometimes forget that they have a very long ESI. Some of them are 140, 160 days. And, you know, if you treat your animals with that, you're stuck with them. You need to keep them until that's absorbed. The Nitro products also have that long ESI. Now, we mentioned the importance of quarantine. To just quickly go through this, the basics is that you need to do something about potentially resistant worms and resistant Fluke, and you ideally need to give 2 Fluke actives and 2 worm actives at the same time. So if we look at the options here, there's really no doubt that doing NitroFluke and Platinum will be an extremely good option to treat resistant worms, which is what Cydectin Platinum has been recently registered for, and NitroFluke is the most recent registered Fluke product and does resistant worms. So those 2 products in option 1 have been specifically designed to be high performers in the face of heavy resistance. So you could say that's best practice, but because of the NitroFluke there, you'll have a long ESI. Number 2, you still will achieve 2 Fluke actives and 2 worm actives if you went a plus product and a Flucosol, but you're relying very heavily on the triclobendazole to try and get your young Fluke. So you might fail there, but look, at least it's better than just doing 1 ingredient. And then the third option there is, well, you could do a Verbamec Plus and Nilzan. That would still give you 2 worm actives and 2 Fluke actives, but you're only going to be removing the adult Fluke. So if someone was to do that, you probably need to consider a retreatment again as those immatures are growing up, if you really want to try and clean them out, which would be important. And we can check if it worked by, as I said, 2 weeks later for worms and 28 days later for Fluke. Now, sheep, my goodness, I'm not actually the Sheep Tax Services veterinarian, but the principles become slightly different here because we want at least 2 Fluke actives, but because of the scale of resistance problems in sheep, to make sure you don't bring in someone else's problem, you almost want 4 worm actives, or some people even say 5. But the way I see it, you can't get away without using 3 products to do proper quarantine. That could be something like tridectin, which is amoxidectin, levamisole, BZ combo against worms, closantel, and Fluke care. Or another option with different brands, Zolvix Plus, Flucazole, and Nilzan. Now, you know, they would give you what I've said would be the ideal, 2 Fluke actives and 4 worm actives. Now, you got to look after the sheep. So a lot of people ask me about this. You can give all these type of things on the same day. You don't have to let them out and remuster them. You simply start with one product at the start and go down. And by the time you get to the end of the animals that are in the race, the one at the beginning will have recovered enough and you can give your next product. So maybe you've got 20 sheep or something in there and you can do that. Very labor intensive, but you know, it depends. It is an important issue not to bring in chemical resistant parasites to your farm. Same idea of checking. So David, hopefully it didn't take too long to go through the misconceptions. I'll pass back to you.
Excellent, thank you so much, Matt. So we'll just ask a couple of Q&A questions. So my first question is, now will you get synergy when mixing trifecta and triclobendazole together?
Yes, so trifecta is a triple combo containing abamectin, a white and a clear, and then you're joining it to the triclobendazole. I'd have to check. I think albendazole is the active in that, David. I haven't got access to the internet quickly, but there is work that was done by Joe Bore as to which actives had the best synergy. I believe that there could be some synergistic effect between albendazole and triclobendazole, but I have a feeling from memory that it's not as good and you don't get quite as down to as young stage of Fluke. There is a table I know in New South Wales DPI fact sheet that would give that idea. Now, the mixing of products raises some other issues to be aware of. You have to be extremely careful that you are really shaking that product well if this is you're given advice from someone to do something like that. Most of one of the flaws of oral drenches is they suspend out really easily. So if you don't shake them, you can actually get quite low efficacy. And then if you're trying to mix it with other things, you've got to be careful that you keep mixing that. What you don't use on the day, if I do any mixing, you've got to discard definitely. Now with the dose rate, you've got to make sure that you give the dose of each product. So I just not thinking about those products. I don't want to give advice on those products, but in general, if you were doing something like that, you're actually probably going to have to give double the dose rate of what you were doing because you actually need to get a volume given to the animal of product 1 and also product 2. So if you were using a low volume product before, like Flucazole, you will need to use less than if you try to mix up to make that. So please seek some advice on that. Generally, what we're instructed as veterinarians is that where there's a pre-existing product that is registered and mixed, that is by far preferable to do for both safety and efficacy reasons. If there is not a registered product for a purpose that you need to do, that's where we tend to get more into mixing.
Excellent, thanks, Matt. So you mentioned frost. Now, does the snail die when frosts occur?
Oh, look, the snails do have a lifespan, and I'd say that when it gets really cold, more of them give up the ghost, so there'd be a higher rate of mortality, but there's not going to be a full wipeout. Like, we're not waiting for re-establishment. They are rebuilding from a low base. But the idea of the frost was always said that that's going to significantly force these snails into not being very mobile. I don't know, maybe the snails can hide. I'm not an expert on the snails, but yeah, you don't fully eradicate them with the frost.
Excellent, thank you, Matt. Now, are there any contraindications or contradictions of using Nitromec injection at the same time as a 7-in-1 vaccine?
No, those products can be given at the same time. Whenever we use injections, we always need to be careful. I mean, every type of animal health product, whether it's an injection, pour on, or oral, has pros and cons. One thing with injections is that, you can lead to site reactions under the skin. So you don't want, if you use two products, you're going to really increase the chance of a site reaction if they're mixing near each other. So that can happen between lots of things. So generally what you try to do is give them on opposite sides of the neck. But this is where injectable products, you really want good facilities. You ideally want crushers which have a proper little gate you can open up, not the ones where you swing open the whole side. So ideally you'd put them on opposite sides of the neck. If you can't do that, you would need to put them a hand width apart, perhaps going sideways. But look, I see lots of cattle. It's not always easy to do this. So the other thing with that, which one should you give first? I'd probably, because the 7-in-1 is a low volume, you could try and give that a little bit away from the neck if you're forced to, so that you can, because the NitroMech is a larger volume product, you maybe want to focus on getting it into the middle of the neck, injecting downwards so that it's like creating a pocket so that the product is actually going in well. Because a vaccine is only like 2-4 mils, pretty easy to do. But once you get to injectable drenches, you've got to give a larger volume and you need to concentrate to get it done properly or you'll get leakage.
Thanks, Matt. So everyone, we're running a little bit out of time, so we'll go through maybe another 5 questions before we wrap up. So Matt, liver fluke and stomach fluke, are they different and what are the treatment options?
Yeah, great. No, they're very different parasites in that paranthostomes is the stomach fluke. I mean, pretty much paranthostomes, the stomach fluke, are found over a much wider area than liver fluke. So more producers will have stomach fluke. But every property that has liver fluke, in my experience, at least on the northern rivers, will have stomach fluke as well. So if you have liver fluke, you've got stomach fluke. Now, there's a lot of debate as to how harmful stomach fluke is, and it's a classic example that if you get a laboratory report and you see stomach fluke, there's a temptation to go, that's it, that's my problem, need a solution, what will work? But a lot of the time, it's of no harm to the animal. And I've done many postmortems in cattle, and I see a presence of stomach fluke, and in my brain these days I go, yeah, that's not the cause of my problem. The animal had a robust immunity to them, and they're just living in there, some sort of, not doing much harm. Stomach fluke causes a disease syndrome, specifically if you take cattle out of an area that doesn't have stomach fluke, bring them onto, say, a floodplain, they're young, no immunity, and they will literally squirt diarrhea out the back end and it will not respond to any drenches. Now, in the scientific literature, there's a paper that explains that oxyclosinide given twice, it's not on the label of oxyclosinide product in Australia, but with your private vet, you could seek advice, and that is the only therapy we have listed, at least in the scientific literature, but not on the label. But don't lose sleep usually about stomach fluke. Generally, your problem will be something else.
Excellent, thank you, Matt. So back to NitroMech. As a standalone, is it classed as an effective fluke and broad spectrum drench, or should it be rotated with something else?
Yeah, okay. So generally, everybody loves the idea of a product that will do worm and fluke together, and it's very hard to have an ideal there. So the fluke part is easy. NitroMech is gold standard, amazing against liver fluke. It's got both the nitroxin and clausulon, so you'll get 99, 100%. Against worms is a little bit complicated. It is broad spectrum. It contains 2 ingredients that work against worms, ivermectin, which is quite a older mectin, and on its own is facing chemical resistance, especially in things like Barber's pole and Capuria. But NitroMech also contains nitroxinol, which also kills certain species of worms, especially Barber's pole worms. So actually in a fecal count reduction test that I was involved in, Nitramec had the highest kill rate against Barber's pole worm in young cattle than any other registered product in the market. So, but a worm species called Capuria would be an Achilles heel of Nitramec. But luckily, Capuria is not the most production limiting worm. So the best answer to that question is, it's a great thing to think about. You can rely on Nitramec to a certain extent for worm control, but you should bring in other actives into your program at some time and seek advice for that. And specifically, that would probably be some form of mectin levamisole combo just for worms.
Excellent, thank you, Matt. Now, if you do have any questions after tonight, please continue sending them through to us, and we will answer all questions here tonight. We won't get through everything, but we will answer everyone's question post-webinar. So final two questions. Matt, for the dairy producers here, is there a nitro-like product?
No, unfortunately, nitroxanil is not going to be allowed for milk producing animals. That's not necessarily a decision of the manufacturer. That is the way that it is for milk production. So dairy farms have a particular challenge in liver fluke control. Best practice would be thinking at that. So first of all, if we're just thinking about the milking cows, what to do. So adult cows, best practice would be to think, how am I going to get 2 Fluke actives in at dry off when I don't have to worry anymore about the milk withholds? And so you can achieve that by using a plus product, and flucosol is what some producers are doing. That's a way to try and tackle triclobendazole resistance on the farm. So that's an example, say Verbamec Plus and flucosol C same day. That will be 2 worm actives and 2 Fluke actives at once. So that you could do that dry off. With heifers growing, you do have a little bit more flexibility, but you still can't use nitro per label. In those animals, you can choose to use flucosol sometimes, plus sometimes, and bringing in oxyclozonides such as in Nilzan. So I know that sounds a little bit complicated, and I can't give a one-size-suits answer. It really needs to be followed up with a local advisor. But the principles are, bring in more than one active. Don't just rely on a plus product in a dairy farm. That's not good enough. Don't just rely on an oral drench either.
Thank you, Matt. Now, should I treat Feb or March drop calves at marking in early May coming off high-risk pasture?
Yes, so if those animals are born in February and then it's May, you know, they're a couple of months old. Generally, my guideline is that animals start collecting significant enough fluke or worm burdens at around 4 months of age. So it's kind of close, and maybe you might want some farm data on that. Just check that products that you're using are definitely safe. Some products have weight restrictions, some products have age restrictions, so just check that. I have been surprised by field research I've been involved in, is that as you move parasite products younger, I've been surprised to still get significant productivity gains. So I think in general, think yes. And in many people's farms, I've seen amazing productivity change by decreasing the amount of drench being bought in mature adult animals, starting earlier in young animals, doing more treatments in young animals, and easing back as they age and get some immunity. And that's particularly true for cattle.
Excellent. Thank you so much, Matt. I've actually got one more final question, which I think would be quite interesting. And that is, if I need to treat for ticks as well as liver fluke, what are my options?
Well, the only sort of registered fluke product that would work well would probably be Nitramec in a way, because the ivermectin in it is still working well against cattle tick. Cattle tick is a complex parasite, but it will, of course, rapidly re-establish on your animals. So while that treatment will, you know, hassle the tick that are on that animal that day, and also for little while afterwards, you will need a strategic tick program to think, well, what am I going to do now? Because you can't retreat with Nitramec for many months. So you're probably going to swap then to just a more focused on tick product. But if you literally want an all-in-one for worm, fluke, and tick, the product with the registered label for that would be Nitramec.